All right, let's get started. So it's on to you.
Pull up a chair.
So looking for your questions, stories, thoughts, anything random. Emma gets started.
So I had a question.
Tell us who you are and the sort of
That's helpful, thank
My
you.
name is Emma Richardson. I work here at the Evaluation Center. And I have a question, I guess it's mostly for Mary. And it's a little bit around the mechanics of when you ask people to individually sort through, say, 99 statements, how much guidance or can or should you be giving? And I guess I'm thinking of a specific example. I consult to help United Nations country teams do their strategic planning processes. And as you mentioned at the beginning of your talk, a lot of times it has to do with sort of how do you get that real engagement? And I think it often has to do as much with sort of the real political will and desire to get that engagement, because at the United Nations level, what you ideally should have is country staff working with government, working with members of civil society to come together and decide on a strategic plan. So in that case where the sort of could be 50 statements about where the United Nations country team should be going in the next 5 years, can you give detailed instructions to individuals to, when they're ranking, or not necessarily ranking, but organizing those ideas, to include more than one criteria? So in this case, it would be like comparative advantage of individual agencies and or the country situation. And so there's like 2 or 3 criteria, or is that too complicated and you just sort of keep it very simple? So I just was wondering.
Let's take 3 or 4 questions and then on to that. Merosh.
Mary Chapman from Ontario Ministry of Health, and my question is not related to my current job. And you were talking about our stories about engagement. I've been involved in engagement through my other jobs with the Gulf and Waterloo. One of the challenges that we face in Gulf especially, because in Gulf we knew what we were going to do with the result of it. The community organizations were going to adjust their services according to the outcome of that information that we were gathering. But and so since it was very broad, generally we wanted to find out in terms of health, community services, education, in all aspects of the youth issues. Then around a lot of these issues, there are organic groups, advocacy groups existed that they already knew what it's supposed to look like. And that was an interference in terms of we wanted to hear from community what they want, what they see as the same problem. They have already determined. So when we wanted to gather that information from community, we had to really struggle at times to kind of push them away to hear from community. And then they were flagging, oh, they are silencing us, they are silencing us, oh, they are tyranny. The thing is, how do you do that? We didn't account for that at the beginning, and now I know next time I'm going to have to account for that. But have you faced those challenges, and how have you dealt with that? So you really hear from community. Advocates have good intentions, but they already, without talking to really that extensively, the community decided what it should look like.
Yes.
So that's a challenge. And then another thing about being anonymous. I think when it's anonymous in a certain area, depending on the issue, let's say for government, whistleblowers, they speak when it's anonymous, but when it's not anonymous, they don't speak. And also reading the comments back from Globe and Mail and different, when I read, in my opinion, I call it ignorance. Some may say, wow, someone else thinks like me, but people make comments that they don't make comment, openly because they get into trouble.
Yes.
But you also see the problems of the society, like what you need to work on, what the curriculum school may need, what are the issues that you need to be addressed in the community so we won't end up where we are now.
Okay, one more comment.
To the first question, Emma, when we think about the process of capturing what people think, and then we ask them to do the sorting, I can tell you the rules, which are pretty basic, and that is that we don't typically say, think about this structure. We don't typically say, we're talking about public health, education, environmental interests, and childcare, or whatever. We typically say, these are issues that have been surfaced from you around whatever the focus prompt is. And as you can imagine, then, the importance of crafting the focus prompt, again, diagnostically and therapeutically, is really, really important, because each person you're asking has got to be able to answer it. You don't want to ask someone to do something that they will struggle with doing. Yet. You'll get to that. So when we craft that, as I said, it really is a diagnostic or therapeutic exercise to plan these things, and I really can't emphasize that enough, as Alex was saying too. When we get to the sorting and folks are confronted with 100 ideas or 85 ideas or whatever the number is, we really basically say, this is up to you. Here are the ground rules. You cannot have 85 piles of one statement in each. You cannot have one pile of 85 statements. We would rather you don't have two piles of 40-something each. So we talk to them about, just in terms of how people organize their thinking. Some people are clumpers and some people are splitters. And so we talk about those are both right. And so the only things we ask of people is to not create a miscellaneous pile, and to not think only about their own perspective, but this is a meaning sort. This is the relationship of these ideas to each other, rather than just what's important to me and what's not important to me. So at that sorting level, and this is the opportunity for you then to really have them understand the content in a way they may not have if they were just contributing ideas in a group like this or online. This will be the first time they will have seen the entire set. So we really try to have people learn, again, being prepared to respond to your request is what we're seeking. Sometimes we have done work with NIH in particular where they want to preload the instructions for sorting to say, think about these things. We sometimes allow that as long as we say, this is not the rubric under which you should be sorting these things. These are suggestions as to ways people might filter them. Take your own best approach. And then that, coupled with ratings, is what allows us to say, these folks, and we also collect demographics and respondent variable questions as well, so that we would be able to say, for example, in the example I showed you, these are the priorities according to the individuals in location A compared to location B and C and so on, because we collect that sort of information too. And that's where people are allowed to articulate priorities. Not allowed, but even, encouraged. And then the interpretation is really quite important. The question that you raised, and I'm sorry I didn't catch your name, was about advocacy groups and gatekeeping. And for us, this is a very salient issue. I think anyone who works in community-based participation, it's almost that nothing about us without us. It's almost like the CBOs take that seriously. And they think that they perceive themselves as those who know best. And that is a really difficult one because, with that social ecological model that we looked at, what we're seeking is putting the person in the middle of the bullseye, but it's obvious that the organizations and communities are going to be our means of access to them. So when we think about therapeutic planning and so on, this is a really important thing, because if these folks are shoulder to shoulder with you, then the process will move along more readily. If you are face to face, then you will be having some issues because they will be blocking your vision. They'll be blocking your view and your access to the folks on the other side of their gatekeeping. This happens a lot. I've developed something that is useful in my work, and I've used it a little bit. I haven't published about it. It's called a complementary action partnership model. And we worked on this with the Centers for Disease Control, working around the issue, specifically around health disparities. And with a group talking about that in particular, I just did a concept map to ask them what's a specific thing that a partnership to reduce health disparities in the U.S. should include. And from that, we created this partnership model that just shows sort of a process model. It's a sort of linear consecutive model about what you have to have in a partnership before you can have this, before you can have commitment, before you can have access to individuals, before you can tackle the question. So we don't, in this model, we don't even get to tackling the question because the model shows what is required preliminarily in order to get people who may, everyone is working for the public good. The question really is, how do we harmonize those efforts in order to get to what we need to do? So that's a model that I use in my own work, and I'm happy to share it.
Alex.
I guess I'll be very brief. First off, there were caricatures, right? I think there's lots of reasons to use anonymous feedback. Occasionally, it's the right thing to do. No, not all town halls are like how I described. And I think it's a really good point that once you get beyond the kind of platitudes of all of this, it really does require some care and really thinking about how you meet your specific needs in your environment with the resources that you have available in a way that seems authentic. And so that's why I'm saying don't do what we do. Do something that's authentic for you, that is valuable, and that kind of aligns with those principles. When it comes to that kind of interference of groups, we often do we do some stakeholder engagement work in parallel with our public and citizen engagement work. So what we're trying to do is think very carefully about the power dynamics amongst those groups and find silos for them to exist in a way that allows them to have good conversations about the issues that are important to them. So citizens are going to have a very different discussion about the issues than providers are, and providers are going to have a different discussion about the issue than a specific special needs group or a particular cultural community or a particular political angle on an issue. And so depending on the issue you're working on, thinking carefully about how to balance out those various different parties. A lot of our work is focused on surfacing the public at large, right? Like we often forget about them. We do all the interest groups and we do all the providers and all the stakeholders, but then we don't actually reach out to everybody in some way because it's really hard. It's ambiguous, right? What that is and how I know when I have the public in a room. How do I tell? But thinking carefully and then making sure that you're not taking on more than you can handle. I think that's sometimes the engagement eats the organization because you start with one thing and then you realize that you need to give this person an opportunity, and this group, and it becomes bigger than you expected. And so before starting, thinking very carefully about who is going to need to participate in order to feel like you've dealt with this issue fairly. And sometimes it's better not to, right? Like you can actually hurt the process if it comes across as unhelpful or unfair or unbalanced.
Can I make one point? In this specific case, Wolf case, providers were on board, 22 organizations were together. It was when there are activists, a large number of them were actually university students. They were service providers. Yeah. So it was dynamic. Service providers were all on board and they were providing access to the community that was going all well.
The way that we find works most effectively in our processes is to actually have those people come and speak in front of the citizen reference panel. If you have a particularly strong advocate, give them the podium for like half hour with everybody else, right? And they feel really involved if you're upfront with them. So that's often how we'll deal with that dynamic. And advocates, their kind of way of working in the world is that I've been a community organizer, so kind of think this way sometimes is no one is listening to me, and I need to find a way for them to listen. And if I am loud and if I am persistent, then I'm going to get listened to. So when people say, "Great, come on in," it changes the dynamic right away, and it gives people an opportunity to actually have a good conversation rather than feeling like they're always having to fight their way into it.
One of the things that we've experienced in some of the more political environments in which we've worked with some state governments and so on, is that we, in a project I'm thinking of as an example, engaged across the state on a very particular issue, and the process was very inclusive, and those who were invited were quite broadly described as representing interests or advocating for interests, or those individuals who experienced this issue themselves. And then we completed the group concept structure. We developed task forces, and we invited more and more people in. We had about 100 people working on this task force. We authored a state-approved, the governor accepted and agreed to forward the recommendations for action to his departments. And then one voice that had not been heard from, not because she was not invited or this particular territory of interest was not invited, but it is a habit of this entity and this agency to be assertive provocative, which is a way to say the design is done and they say, but we don't see ourselves in it, it's flawed. And so, again, this concept of diagnostic and therapeutic planning is really, really important. Who is missing? How many times do you have to invite them individually in order for you to have a record that you invited them, whether they come or not? So there are lots and lots of issues around this sort of political, philosophical, and practical that we should be thinking about.
Mary, this is perhaps an unfair question, but in your work, have there been examples of action that have resulted as a result of this process that's been surprising? I say it's unfair because in some sense, this process generates recommendations, and
yes,
there's a lot of other filters along the way before actions actually get implemented. But we are in a knowledge institute, the Education Knowledge Institute, where we often are struggling here in moving from knowledge generation towards some serious knowledge translation,
yes,
where we have the crap on a series of sort of linear kind of processes. So I think we're sort of, I guess the reason I'm asking this question is we're really searching for slightly better models of translation. Let's get to the action without blabbering too much about processes, etc. So, any thoughts?
It's a big question.
Yes, that's why I said unfair.
I guess, Sanjeev, are you interested in recommendations that came out of these that are processes that were surprising, or actions
I'll be satisfied with recommendation, but I'll be thrilled with actions.
Actions
that's right.
that were surprising that they were implemented.
Yeah, they were, exactly.
Right.
Said,
No,
so I guess that they have to. I'm looking for recommendations that were surprising, but that actually somebody bought. So way out recommendation.
I think there's lots of examples in our work of uptake of those recommendations. It's hard to say whether those recommendations would have been taken forward if we hadn't had a process, right?
Mm-hmm.
Like they after considered thought by citizens, they become really reasonable, and so maybe the organization would have done it otherwise. But a good example with our Metrolinx panel is that the recommendations of the Metrolinx group are cited by the board of directors in their public presentation about what taxes and tolls they think should be in the GTHA to fund transit. And their recommendations line up very closely with what the majority of the panel put forward. So that's an example of a recommendation actually being taken forward. Mm-hmm. And then I think another type of measure is how much acceptance there is for something hard. So when we did this work with the Northumberland Hills Hospital, they were cutting services to a community hospital. This is the sort of thing that gets people so up in arms, right? They decided to cut a palliative care unit, which the community really cared about, but it was recommended by that group. They said, this is great, but we think actually it's better to do in the community, and you as a hospital need to work with your community providers to figure this out better. And what was surprising was actually what didn't happen, which was they didn't get a drop in their donor dollars, they didn't get a drop in volunteers, and there weren't a ton of protest letters and things in the newspaper. And so the sense that a tough decision is accepted, maybe not loved, but at least accepted by the community, I think is a surprising and promising result.
Mary.
Well, early on in the work that I do, I was always surprised when something did happen, because I worked a lot early on, especially in the federal government, in National Institutes of Health, and a couple of other places where power is important. And a lot of the work was in population health, so that the disconnect between the audiences we were seeking and the policy and research agendas that emerged were thought to be noticeable, and the policy and research agenda recommendations were in some cases, I wouldn't say startling to those who would need to think about them, but they were off their track. They had a track, they had a research track, and that's what they were thinking about. And then when the information is thought to be more appropriately representative of a community of interest, there's a project we did in Corpus Christi around cervical cancer for minority women, which really sent a ripple through some of the work. They, I don't know whether it's a question of whether there is uptake, but sometimes it's when. And in the process, the yearly, multi-year cycle of grants and RO1s and all of those things that are required in order to support research, there's a significant lag. And then there are power changes, of course. That is one thing that will always happen, and that is you will have a champion or a sponsor or a set of steering committee folks or something like that, and over time, that population will change. You'll no longer be working with the people who were the champions. So that's another thing to think about, both politically and practically. How do you then encourage and the continuation of support and movement forward in the project that you've helped them to construct?
Before I turn to Eileen, a question.
There's a question over here.
Before I turn to
Sorry.
a couple of questions in. I'm really curious, there's Health Quality Ontario, the City of Toronto, here there's Toronto Public Health, a range of different organizations. I'd love to hear from you about your own experiences with stakeholder/community engagement, which have led towards some series of positive outcomes. Eileen, and then Hannah.
Well, it's interesting that you mentioned that, because what I took from the presentations was that in some ways you were talking a lot about community consultation, but not so much engagement, because there was nothing there to sustain the engagement of the people that you were consulting with. So I was wondering whether the organizations that hired you, or government that wanted to convene these people to provide input to the programs or services that they were planning, if within any of those organizations, agencies, there was any thought or attention or support to sustaining the accessibility and availability of these voices. And I could speak to, I'm at CAMH, and I'm part of this drug treatment funding program that convened a group of people with lived experience with mental illness or family members to provide input into these drug treatment funded programs, but because they valued the existence of this group has now become part of the organizational structure and is being supported and is being made available to other departments within the hospital that would also value the input of this group into the services that they provide. So that's just an example of a mechanism to sustain the initial consultation and the engagement.
Yeah.
That's the experience of the group that I'm in.
May I ask you a
don't know if you want to
question?
speak to that, because I did have a question.
Well, I think this is really right up Alex's alley, but I also think that there are models in what I've done around this as well. Question would be, is this entity, the purpose of the group, is that institutionalized, or is it the individuals who continue to be involved as a group? In other words, is the population, is there room for the population of that group to change while still maintaining the institutional value of the group, or is it just this set of people because they're very committed in particular?
Originally, the group was convened to inform this one group of programs. It's now an institutionalized group, but because it's been 4 years, the membership does change,
Uh-huh.
but what I see is that there is institutional commitment to this group and to ensuring that there is continued participation, so there is someone hired to ensure that it will be, like, that new voices will continue to be brought in and to make sure that it's representative of the populations that are served too. There's a real commitment to health equity.
Great. But you had a question.
Oh, my question actually was about ethics and ethical procedures that are used in the work that you're doing, because you're more of an academic researcher, so I'm sure.
Well, now, wait a second.
Okay.
Wait a second.
Sorry,
No, I'm only teasing. I'm actually not an academic researcher. I run my own company separate from
Okay, so then
that.
perhaps you can both speak to whether there are ethical procedures that are used when you're doing your consultation / engagement to ensure that, especially when you're working with vulnerable communities, to ensure that risks are known and there's, people understand how their voices are being used and not exploited,
Yes.
and the power differentials.
Can I take another question from here too?
Sure.
Thank you for asking the question on ethics. That was actually one of my 2 questions.
Yeah.
So
Can you tell us who you are?
I'm Benedict from Health Quality Ontario. And my question was exactly the same, tips and tricks when it comes to ethics, applications, and implementation of your projects and research. The second question was somewhat related to the gatekeeping of the participants that you have as part of your groups. I'm just wondering, do you have any anecdotal evidence, not evidence, but examples perhaps of projects that you've looked at where you started to include people from the media as part of some of your focus groups? I'm just thinking of it from the lens of HQO, our lens is public reporting of information. We want to build that capacity in our public reporting. It's not just stakeholder engagement, but capacity building of the public and teaching the public of the area of our work, how that information can make a difference in their life. So there's that stakeholder engagement, which is very key. But there's also that capacity building, which to us is the other piece of the puzzle. I'm just wondering, in your projects, have you had examples of things like that, and in what cases have they been appropriate to media?
There's a lot of good questions. I'm wary of us running your
Tough ones, by the
time.
way, too.
No, I think they're really great. So I'll try to knock them off relatively quickly, and I'm happy to take this up after we adjourn. I can't stick around too long, but I'm happy to get into some discussions with all of you. On sustaining engagement versus episodic engagement, I think there are benefits to both. When we run a reference panel, because it has a very clear task, often the organizations want to sustain them, and we say don't. You need to let these people go back to their communities, and you need to let other people in the door to play this role. And part of that is about the challenge of being a representative. It's a hard thing to do. And when you're helped and held and supported and staffed to be a representative, which is what we're doing for these people, they can do it effectively for 4, 5, 6 weekends. But it's not necessarily the case that over a year or 2 years or 4 years, they can't just simply become captured by an interest group or a particular segment of the population. And so though their mission is to represent the public at large, they become more like a stakeholder or an advocate.
Yeah.
And that's not a problem. It's just you have to realize that that's going to happen and be ready to deal with it. That said, I think there is great purpose for standing committees and standing feedback. You can help people grow with an organization and change. And that question about, which I think was a great one, about whether people can move in and out of a standing committee, and there's a regular process for that to happen, is a really healthy one to help that standing committee of citizens sustain an engagement. And then the last thing I'll say is that I think this is a question about organizational culture. right? So how ready is the organization to change the way they work, not just at one time, but over the course of their lifespan, over the course of whatever cycles they work through, and using an engagement as an example to nudge a culture in the right direction. So that's kind of our intention when we work with our clients, is really to bring them in, talk them through the process, sit them down, have them watch it, see what's different, and then bring some of those lessons back to the day-to-day of their organization. That's what we're able to do to help them sustain engagement over time with their community, but to circulate, right? To keep the lifeblood moving, because new voices are really important to the process. In terms of ethics, our main tools are, there's three. There's one, which is our internal compass. We're a private company with a public mission. I'm not interested in profits. I'm interested in doing good work, and this is the organizational structure that allows us to do it. But we have to create a very careful relationship, and so we have a dual contract with our clients, right? It's to say, we're not here just to serve you. We have a bigger mission, and it's really important that you understand that this isn't just a standard consulting agreement. You need to be on board, and we'll be very careful about choosing our clients. If they don't seem to be, planning on co-opting the process in any way, we're likely to turn it down and be very careful about it. So that's one. The second is we often strike advisory committees of respected experts who we can turn to about issues around confidentiality, about co-optation, about making sure people are participating effectively. So we'll get together some folks who really understand those particular ethical concerns and have them as a sounding board throughout the process. And then the third is really rigorous transparency, both with the panel members and ourselves. We upfront really try to inform people about what they're going to go through, so we'll send out this welcome package, and we'll be on the phone with them 3 or 4 times before they actually enter the room, so that they really get a sense of what to expect, what their purpose will be, how they'll participate. And at any time, if they feel uncomfortable, we're there to help them work through it, and people can step out or step in as much as they feel. And then at the end, we write it all up, right? So we have these long appendices that describe the activities and the days and who the speakers were, and make sure that it was a balanced and effective research project, right? So those are the different ways that we use to manage those ethical concerns. And then the media, I think they're a really important tool for public learning. I think bringing them in and letting them see what's going on is really important, but not necessarily as participants, as observers and as commentators, who can play an important role. So we've got some lessons that we can chat with you about that afterwards.
Mary.
Around the ethics and accountability question, it's so important to us, and we've been doing this for such a long time, that we do, as Alex has said, we have sort of an internal agreement among ourselves in terms of ethical behavior, and that covers all of the activities that we're involved in. We've, I said I'm not an academic researcher, but of course this all comes out of social science research and evaluation, but we, because we've worked a lot with the federal government and state governments, and also populations that are deemed to be vulnerable and so on, we have every one of our projects has got to meet the criteria that would allow it to pass an IRB, an institutional review board review. So that's a sort of a benchmark for us. Every single project, we ask those questions. We also have Office of Management and Budget criteria that we have to adhere to as well. But the key questions really are how we articulate respect for the individual, his or her position and knowledge, and that's a different story for each. But with these guidelines that are established, all of our work does that. We have everything is informed consent built in, and like Alex, we communicate with people even when there are hundreds of people involved in a project. We communicate with them and ask for their feedback in terms of their own capacity to answer the questions we're providing. Everything about each project in group concept mapping is a little different from every other project. So that's just a fact, because we're asking a different question of different people for different purposes, using different approaches in order to achieve something that doesn't exist yet. Around the issue of using the media, there's a particular project that we've been working on with a state that allowed us to use the media in very interesting and particular ways, because we had a couple of folks from the media on the advisory group. And so they helped us to time and tailor the content that we wanted to make sure people had in front of them so that they were able to do what we wanted them to do. We also, in terms of just reaching in that project, we used just in terms of pulling in content, we used the website, but we also used focus groups and meetings in community settings. And we had drop boxes, and we had an 800 number, and we had all of these means by which people could contribute their thoughts. So that's the other thing about anything like this. You use the tools that are going to fit the purpose rather than what you always say you do. So that's...
Thanks, Perry. First, there's nothing wrong with being an academic researcher. let me make that clear. But before I just come to Sarah, I've got to make one comment. These questions resonated with me because far too often, on one hand, from the face of it, we'll be on consultation and engagement, but let me be clear with, and this is a question of the DTFP team too. I'm no longer convinced that constituting these committees actually exemplifies a commitment to healthy committees. In fact, I'm more and more uncomfortable that these committees actually, in my sort of evaluation of these committees, the conversations get incredibly sterile. So if the view is these committees are engagement dynamic, my experience is a little bit to be desired. So I'm telling the DTFP team, I would love to actually evaluate as part of our ongoing evaluation. Are these committees? I'm very uncomfortable with organizations like us, like St. Michael's, etc., using committees to flag wave commitments towards equity. That's not enough.
Yeah.
We've got to, far more has to happen. So as much as I'm excited about dynamic engagement, I'm no longer on the same page as that in itself constitutes progress.
Yeah.
Go on to say.
Just a comment and a question. On the comment on the ethics, I'm Sarah Earl, I'm with the YMCA in Greater Toronto. One of the things we've started doing is sending our research proposals to an organization out of Waterloo called CREO, Community Research Ethics Office. And for $50, you get this really great set of feedback on your research when you don't have an institutional review board to be able to apply to it as community members and academics. So just wanted to give a small flag that that's been very helpful for us. But now my question.
Yes.
I really appreciated that both of you spoke about a joint learning process. And you, in different ways, you spoke about how you bring experts in, how sharing facts is a part of the process that we all might take for granted, but other people may have not had access to. And I'm just wondering, what we're trying to do is find this, what I call the developmental evaluation, muddled middle between established research findings or evaluation findings and participatory engagement processes, and getting both to reinforce one another to inform our future action. So not trying to privilege either bottom up or top down, if you want to think of those old-fashioned terms, but find this middle where we're interacting between the two. And I wondered if you could share tips, ideas, things that have worked that you tried that you never thought would work but did, things you tried that you thought, anything from your experience on how to do that better as we operate in this middle world.
That's a great question.
It's a clear question between like presentation or sharing of formal research or evaluation findings.
Any other questions?
Yes,
Please
good
go
question.
ahead. Adam,
Hi, thank you so much for your presentation. I have two questions.
tell us your organization too.
I'm with CAMH, University of Toronto, Social Equity and Health Research. I'm doing community-based research. I'm with marginalized communities. So two questions. And some of my thoughts are, I feel like a fundamental underlying assumption is that you're working with individuals or you're asking individual questions in communities that tend to be somewhat engaged or mobilized. So how do you apply these principles for communities who aren't organized? And that's the first question. Who are pretty diffuse, say like a particular group of immigrants to a country who don't necessarily know how to navigate a system or don't feel entitled to being participants in their Canadian communities. And second, how do you apply this to particular cultures or mindsets who don't necessarily feel entitled to individualistic opinions, who might be more collectivist in the thought process?
questions on all of you. Grilling us up here, my
I wanted a second question just to give you a little more space to think
No,
of
no,
the
no.
responses, and I realized it was not, okay, let's get a third question.
God. Pile it on, come on.
Can I add on to that question? I think that my questions are actually very much linked to your question. By the way, my name is Catherine. I'm the Minister of Education. And what works part of our work, look at my colleague here, is actually helping the school to develop, and they have, and implement a community, school community, steering committee, where they would make decisions, make an informed decision of how they allocate resources at the school level, and that's including community resources as well. And the membership comprised of not just school staff and administrators, but also parents group, community, and students as well. What we have heard very often, and that could be because of the location of the schools where they're located, is that parents, they work 2-3 jobs
Yeah.
already.
Yeah.
They cannot make it to the time of these meetings, and they also need to they needed extra support in terms of understanding the information provided to them in order to make an informed decision. So very much like to the group that you're talking about, and they all many of them also have that more collective mindsets where they're not as comfortable providing their own individual experience. So again, turn to you, what other strategies or methods that you've heard of or you have used in your work that's been effective in terms of engaging those specific groups?
First or no?
I'll go first.
Great.
The question about how to, I want to make sure I understand the question. How to live in the muddled middle of social research, which is not necessarily best or promising practice, but not necessarily just here's how we do it and here's what we learned.
It's really more about presentation and sharing of formal research as part of these engagement processes.
Oh, great. That's an easier question. You know, as I mentioned before, every different engagement, and I should say I do a lot of group concept mapping, but I also do other stuff. So sometimes this is not the best fit for doing what we need to do. Having said that, when we do work with other groups, you know, I keep going back to that concept of diagnostic or therapeutic planning. And it's really critical to speak the language of the people who are with you. That doesn't mean that you have to speak Spanish in order to do something effective in New York City. It means that you have to be able to articulate the elements of concern or interest to them in the context and in the ways in which the audience would be familiar. That requires your partnering with people who can help you understand that. So the first thing in terms of planning is to educate yourself. And around the development, for example, of here's what the research says, you have to understand that, and then your job is to translate that into information that will be meaningful to people. So, you know, if you look at some of my slides, for example, I had a footnote at the bottom of them. You know, if I were talking to somebody about, you know, there's this idea of getting people's information in so that we can take a look at it all together. That's the kind of thing that I would say in community groups. I wouldn't talk about stakeholder engagement. I wouldn't talk about valuing voice. I would say, here's a way for us to think about this stuff together. And then you can say, here's how some other people thought about it together. So the language, it's your job as a consultant or as someone who is going to organize the community to express itself most effectively and usefully for the purpose that you're asking, is for you to be prepared to play, to speak using different vocabulary depending upon, to show not only respect, but to be effective in terms of the audience you're talking to. I'm not telling you anything you don't already know, I'm sure. And then I think that Alex probably has some great examples of using information about a particular topic, whether it's Metrolinx or United Way or any of those other ones, where you'd say in the package, in the conversation package, how you use plain language, how you break the information up so that it's easily accessible and easily, that there's easy uptake and understanding of it, so that you can get on with it, which is really the point. I hope that's helpful. When we think about how to apply this to organizations and people who aren't typically asked, which is really the driver here, and that's what these questions are about. What are the obstacles to doing this? And until we really articulate in your context what those obstacles are, what are the obstructions, and what are the variables that will cause you to not be able to reach the voice that you're seeking. Is it a systemic issue? Is it a political issue? Is it a structural issue? Is there something about, for example, the school systems that tells you that putting together a community-based steering committee is a non-starter? It's a question to ask, because if in fact the homework that we have done in advance of establishing that has not taken into account the equity of the voices, then we have to go back. We have to go back a step. We have to basically say, in order to assert that this community-based school group is going to be able to do what we're designing it to do, what do we have to do to bring those who are not typically asked to equity, to an equity position in this power construct? Because make no mistake, as soon as there's a principal and a teacher and a parent in a room, there's a power construct. So when you're thinking about how you raise the level of engagement, of self-awareness of one's own capacity to contribute, and then open up the doors for that to be almost primary place in this dialogue that you're going to be having between the typical powers and the powers of those who need to speak. So there would be, in my view, there would be work done up front to raise the level of that group's engagement, of their understanding of their own capacity to contribute and to support the process, so that they are, I'm thinking about this practically now. You might even do something like coach them earlier on in the process before the thing is even seated, and then actually prior to any meetings that you hold, have a half hour or 45 minutes with that group only before you actually have the whole meeting, with a very particular agenda around capacity building. In terms of the timing, this is always an issue. When you're trying to reach people who have 3 children and 4 jobs and no car, then the way you schedule your work for the project will either demonstrate respect for their circumstances and for their need in the project, or it will tell them you were only kidding. So that's just a way to look at it. That's
Great
all.
thoughts. I don't have anything especially astounding to say about how we exist in the muddled middle. I think we have to treat ourselves as translators. We have to talk about that, how our job as people who work in the middle of these things is to figure out how to help researchers and evidence people give information to the public, and then on the other hand, help the public or participants translate that information back. And that's what we're doing with people during our process. We're training our speakers, and then we're training our participants and helping them work through it. And then creating learning materials, right? Thinking about communications not as an exercise in convincing people, but in giving them the building blocks that they need to come to their own conclusions, which I think happens far too infrequently. So if we take communications as learning, I think we're much more effective as translators. But those are just some helpful kind of frames that I find are useful. As for engaging folks who, part of our process is about engaging people who aren't mobilized or organized. That's the point of sending random letters to people's addresses, is that they're often people who volunteer in their communities, who are interested, but aren't the advocates, aren't the political folks who are engaged in all of these things, who would normally go out to a town hall meeting. That said, there's certainly issues around feeling like you're entitled to participate. I think that's a really good question. And so for certain communities, this isn't the process that needs to be used, and alternative avenues need to be constructed to make sure that you're getting at those voices and supporting minority views. The cultural dimensions of individualistic thinking versus communal thinking, I think, is another really good one. I think you can find a middle ground by asking people to work on behalf of others. That's kind of the point, is to say, you can have a perspective, but what's really important is your ability to think about what everyone needs. And that's a really fruitful conversation for people to have, and giving people different avenues to come into it based on their learning styles, based on the way they work. The other thing I was going to say about learning is that we actually often, we've learned a lot of what is great about learning in kindergarten already, right? Like there's some really simple principles about cards and sorting and having things that we can hold on to and different colors, and just playing with things allows you to design really helpful learning activities that people engage with in all sorts of different ways. And we've been trained in this really unnatural way of thinking all through school, right? To think in this very rigorous and top-down way, and it's important to step out of that and provide people all sorts of avenues into the material. And then in terms of balancing power dynamics, I think the best you can do is, right, one, create alternative ways in, and two, try to find the most neutral ground possible, right? So think about all the different areas that your group are coming from, and what's going to be the most neutral space for these people that balances out those power dynamics. You can't get rid of them. They're going to be there. We can't wipe the slate clean of privilege and power and all of that, but what we can do is try to find somewhere in the middle, and then have a high enough ratio of staffed supporters who can kind of hit the reset button if things go off track, and help people stay on course. So again, not rocket science, but requires really careful thinking and the help of others about your blind spots. So I think the people in this room, right, the people in your organization, and people in other organizations who like to think about this stuff, use them when you're thinking about a process to raise those questions. We can be partners in all of this.
Questions? I've got one question. I really struggle with this. I never know, when we go through a community engagement process, how do you know that the community is actually represented? So let's take the example you use, where you actually, you got the proportions, you use 3 variables, etc. For me, I'm still sort of struck with so what? Especially if equity is such a serious problem. I would say that's the one thing you should avoid, of actually having the tyranny of the majority itself. And so that's not convincing in terms of, and on the other hand, I don't have an alternative. And the other part that I've learned is there are the usual suspects who usually show up for these kind of things, and there's also a professionalization of that kind of engagement that happens, right? Which again is far from ideal. All that said, I'm still left with the question of how do you know? Well, this actually smells like a community, etc.
Yeah, exactly. It's a great question. And I think both of us are in the position of working for someone. So if I were able to be a philanthropist, which I am in teeny tiny ways, I would be able to call the shots on what I'm asking, to whom I am asking it, and how I would expect to have the results heard. I'm not an independently wealthy philanthropist. So that means that I'm for hire. So someone pays for the consulting to be designed and implemented by me and my group. Those people have a right to have a lot of say in the design. My job is to watch how they say and what they say, so that I can say, have you thought of this? If in fact this is a topic about cervical cancer in African American women, wouldn't it be interesting if we sought the input of those audiences? So sometimes they start there and sometimes they don't. And my job is to figure out what I can say this project is about. If in fact they say, no, we're going to talk to researchers and practitioners, then the project isn't about the issues of African American women and cervical cancer. It's about the issues of research around African American women and cervical cancer. So the question then becomes a different question. The focus prompt becomes, something like a specific thing that research on cervical cancer should address is, rather than a specific thing that I'm worried about when I think about cervical cancer is. So they're both right. There's nothing wrong with either of these, but they are not the same question. So the population that answers them will not be the same population. Does that make sense?
Alex, any thoughts?
I think, one, it's important not to get, equity is obviously very important. It's important not to get too caught up in it, right? Like, we're not going to get it perfect every time.
Yeah.
We have to do our best, try hard, and trust that people can be caring and think about others.
Yes.
And if we give them some of the information and encourage them to step into other people's shoes, that they will take that on. And put them through the process of thinking about different users, right? You can create all sorts of learning materials so that people have to think through, what is this like for the person with multiple learning disabilities, and what is this like for the recent immigrant, or what is this like for someone who has an acquired brain injury. And if you can think about encouraging people to do that, I think you can get some pretty good results without having to be perfect on 150 parameters that you've somehow created a perfectly representative microcosm of the community. It's not worth it. It's too much work, and it won't be necessarily useful in terms of creating good results. So I think it's about balancing that interest in equity with usefulness and with the ability for people to learn. I think that's really critical.
And with clarity around intention and how that intention is realized.
Yeah.
Any final Debbie, some thought?
In healthcare right now, there's a lot of emphasis on patient stories and representation. I guess the earlier comment that you made on design teams or steering
Navigation teams.
committees.
Yeah.
Just any thoughts about that as a strategy? Again, it seems to be the interest of the day, and if we do that, then check we're doing a good job on engagement. Can you push my buttons on that a little bit?
I think your take on it is appropriately cynical. I mean, I think the world of healthcare organizations and those who deliver the health service to people. I do like education. There is a sort of the take of the day sometimes when it comes to deciding what's best for the patients or what's best for the students and so on. I think valuing the patient narrative is a really great idea, and I do think that when you think about that coupled with the health navigation teams and so on that a lot of hospitals are adopting, that this can be a really powerful combination. I don't know whether they're combined or not. And so the question really is, what is the uptake? What is the means? What is the uptake? What's the use of these patient narratives in order to achieve something for the person as well as for larger learning for the community? And I don't know the answer to that. But if it's actually used in partnership with the patient navigation teams, I think that's a really interesting way of looking at it.
Yeah, I think the problem with fads is they become a distraction. They become a way to avoid the issue, which is organizational culture.
Yeah.
Right? So we've got to be really careful about jumping from thing to thing, thinking that somehow that'll solve the problem. That's not the problem. The problem is the way we are approaching it and the way we are uptaking, right, the information from it. So whatever tool you want, there are pros and cons. Pick a tool that seems to fit and be authentic. If people's eyes light up in the meeting, if people feel good about it, I know these are totally, they're not particularly rigorous measures of effectiveness, but I think they're our best tests when it comes to doing this well. Does it feel right? And if it feels right, go with it. That's great. But we gotta work on our own organizations, and methods are just methods.
Well, the phrase I heard the other day, modeling towards authenticity. And
Yes.
Mary, Alex, thank you very much.
My
for
pleasure.
joining me. I was more interested in a sustained engagement
Excellent.
over time. So I hope this is the start of multiple conversations
Excellent.
CSI,
That would please me.
NASA Wiki, and the Evaluation Center. Thank you also to my team, Shauna, Haley, Briggs, and
Thank
Bharat.
you.
Just very quickly, what's planned is a major session on systems and dynamics. The idea of so it really starts getting at some of the engagement questions, but from a different angle. So the idea of actually, in terms of systems, how does one actually hang in there, and what does it take to change systems? We're discussing with Bobby Millstead from formerly the Center for
Yep.
Disease Control, now at the
Been
Ripple
working with
Foundation, to come here. So that's next. Thank you all for that.
Let me know, I'll come.
Bobby?
Yes, I am also. I want to say something.
Mary, one sec. Mary wants to have a quick word. Go ahead.
No, I don't. Bye.
Okay, all right.